I wanted to start with, in particular, talking about the ideal order for an intake series, how this might differ between an adult patient versus a minor patient, and who should be involved in these sessions.
There's multiple models that could be seen as being effective, but what I'll say at the beginning is there are some places that you can be sent to work as a mental health clinician, and then especially even as a prescriber where, hey, here's 90 minutes if you're lucky, but here's 60 minutes to meet a new 14-year-old, do an entire assessment, talk to the parent, and get a prescription, which is just bad care. But there are entities you can work for that's what you sign up to do. Ultimately, in mental health, you really don't know what's going on for a few months or until you really get to know your patient. So the idea that you could do anything accurate with just one visit is tough, and so let's come up with something better, and that's where how we do things has evolved over the years. And well, let's start with kids and with minors. Is that our ideal pattern is the first session is with caregivers. And I think like we talked about last week, it is mandated for caregivers to show up. And the one nice thing about telehealth is if a parent's like, I'm too busy for that, it's like, pull out, you can find 20 minutes to join the intake and pull out your phone and be present. And if you've got a parent or caregiver not willing to do that for the mental health of their kid, you're immediately, that's a red flag.
Right.
So we do caregivers first, and then after that session, we'll meet with the child, and it's really helpful, and we always try to make this happen, to meet with the child twice separately on different weeks. So you can meet parent on Tuesday and then do the first child assessment on Wednesday, but then you want to see, it's good for kids and adults also, you're assessing how people are doing with their mental health. Anyone can have up and down days. So it's very helpful to get a week in between sort of intake and assessment sessions. So we'll do a week between the first and second time we meet with the child. And then we'll have a whole session devoted to our impressions. Here's our findings. Let's go over the questionnaires you did. And then let's talk about the different biopsychosocial treatment aspects. There's always a lot of questions when it comes to talking about what you think and findings and treatment plan. And so it's just better to block a whole session for that information. And that's sort of our standard 4-week assessment. I should say 4-session assessment. In life and in practice, it is usually 4 weeks. It's sort of week 1, 2, 3, and 4, just because schedules are busy. You can theoretically do it all in 2 weeks, but that sometimes can be rushed or hard to schedule, just find 4 45-minute times in a 2-week period. It is not uncommon for parents to be very stressed out about having to wait 4 weeks to do an assessment, but I usually refrain it from like, you mentioned it seems like for 18 months there's been issues. So, in order to do as best a job as possible, we're asking to do this assessment over a few weeks, and it's already been 18 months. Like we can make it another month and it will be better for it. For adults, we don't need the 4 sessions, and we usually frame it more as a 2-session assessment where we'll try to get through it. The nice thing about kids is medical history and other parts of they're younger, so there's just not as much history to have to deal with. If you're doing a new intake for an adult, the goal in the first session is try to get through the basics of a psychiatric assessment. But then in the second session, it gives you time to expand on relevant things like trauma or hospitalization or issues with family and parents, and then also bring in the discussion of treatment planning and what to do at the end of that second assessment.